You are listening to Veggie Doctor Radio, and this is episode number 267. Welcome to Veggie Doctor Radio. I am your host, Dr. Yami, board-certified pediatrician, certified lifestyle medicine physician, certified health and wellness coach, author, speaker, mother, wife, and human being. I passionately believe in the power of diet, habits, and mindset in sparking and sustaining well-being and joy in our lives. This podcast combines expert interviews and thoughtful monologues to explore plant-based nutrition, lifestyle medicine, parenting, mindset, and other exciting and fun topics. I hope that these episodes inspire you, uplift you, and equip you with the knowledge and tools to live your best life. Are you ready to get started? Let's do it. Hey veggie lover, welcome to another episode in the fasting series. Now this series is intended to provide education about the potential health and longevity benefits of different forms of fasting, including time-restricted eating, intermittent fasting, and extended water-only fasting. Please be aware that in this series, we will be discussing different forms of fasting and food restriction. And in some cases, there will be references to body size and weight. This material and these methods are not appropriate for children, pregnant people, or people with certain medical conditions. Please do not attempt these practices without medical supervision, as it could be very dangerous. These concepts may also be triggering for people with disordered eating or eating disorders, so please practice discretion before listening to these episodes. Thank you, and I hope that you enjoy this episode. Alison Tierney, MSRD CSO, is a board-certified oncology dietitian, PCOS and infertility warrior, cancer thriver, and all-around nutrition nerd. She empowers others to live their own wholesome life with plant-based nutrition and lifestyle medicine. Allison's approach involves recommendations strongly rooted in scientific evidence. Focused on whole food, plant-forward nutrition, Allison helps patients navigate their health journey after encountering a chronic illness such as cancer, autoimmune diseases, and infertility. Another pillar of Allison's approach is focus on prevention to help others take health into their own hands. Taking whole person health into account, Allison's motto for patients is simple: eat more plants. In this episode of the fasting series on Veggie Doctor Radio, key takeaways are: we can alter our habits and behaviors to reduce our risk of disease, but it is never a 100% guarantee. Don't sit too long trying to figure out why you developed a certain condition or blaming yourself for it. Instead, take action on the things you can control. Fasting before and after chemotherapy can improve the efficacy of chemotherapy and decrease the side effects. Fasting protocols during chemo will vary from person to person and should be medically supervised. Cold capping is a technique that can be used to prevent hair loss caused by chemotherapy. Nutrition can be an incredible complement to cancer therapy and can help improve side effects and quality of life during and after treatment. I hope that you enjoy this final episode in the fasting series right here on Veggie Doctor Radio. Alison Tierney, welcome to Veggie Doctor Radio. It's such a pleasure to have you here today.
Oh, it's a pleasure to be here. Thanks for having me.
Absolutely. Well, we have a lot to talk about, but I want to start at the beginning. Tell us your plant-based journey. How did you get to where you are today?
Yeah, wow. Well, I definitely did not grow up plant-based. I grew up kind of in that, I guess you would say, standard American healthy diet is the way that I like to think about it, is because we didn't eat a lot of red meat or go out for a lot of fast food or anything like that. But so that's how I grew up. And I actually had an interest in nutrition as an athlete. So that's like kind of where it all started. But the plant-based part happened when I was in school to be a dietitian, and I always wanted to be an oncology dietitian. And so I started doing a lot more of my own research outside of school and kind of actually stumbled upon the plant-based diet, and it was really in an effort to help better serve my patients, which in that case were cancer patients. And I wanted to know, how could we improve their outcomes? How can we help them best? And it was really through the plant-based diet that I started encouraging my patients. Now, how it really happened for me was that I was encouraging this for my patients, and I, of course, started following it a little bit more myself, being like, well, I'm encouraging this for my patients. I need to start implementing it a little bit for myself. So that's where it kind of started. But then where it really took off for me and my family was when my husband and I were trying to conceive our first child. We stumbled upon infertility. I have polycystic ovarian syndrome, or PCOS. And we were just about to move over to more in-depth fertility treatments. And before we did that, I told my husband, I really just want to try diving in 100% to this plant-based diet. And I told him, I said, I don't need you to do it with me, but I would like your support in the process. And I have a very supportive husband, and his answer was, of course, if you think it's going to help, and I know you've done your research. He knows me as a dietitian, that I'm all evidence-based and want to make sure that we're doing the right thing. And I said, yeah, I've done my research. I want to try it and just see if it helps before we move on. And we did that, and within a few weeks, I got pregnant. And I always tell people that I had been weaning things off for a while. I had already really cut out meat. I had been reducing my dairy. So it wasn't like I just, one day switched completely over. It was kind of a transition. But from that moment when I decided to fully transition, it was only about 3 or 4 weeks later that I ovulated for the first time in a year and a half, and got pregnant with our first child. And honestly, it's stuck ever since, because I found it so helpful, and it improved so many other things for me that I've never turned back.
Oh my gosh, that's such a lovely story. And I got chills whenever you're talking about your husband and how supportive he was, because infertility is such a heartbreaking, tough journey. And him on his side, just trying to do everything he can, whatever he can to contribute. And he's like, yeah, of course. If you think this is going to help, I'm in. Let's do this. So I'm so glad that he was supportive. And I'm so glad that it led to the end result, which is beautiful babies. So congratulations. That's amazing.
Thank you. Thank you so much.
Did
Yeah.
you feel any different in your body? Were there other physical differences that you could tell, okay, this is the right path for me?
Absolutely. It definitely, first and foremost, the first change that I noticed was because of the PCOS. I did have pretty horrific acne, and this was late into my 20s, that I was still dealing with this. So once I went plant-based, my face cleared up significantly. And I had the really painful acne. So that was something that was huge for me. My energy definitely increased, and my digestion improved as well. When I was in my early 20s, I had a fair amount of issues with digestion that we could just never put a pin into what it was. And ever since I changed my diet over to plant-based, I haven't had any issues from that standpoint.
Oh, that's awesome. Yeah, I feel like those were the first two for me too, is energy, and I was pooping, which was a big deal for somebody who had pooped regularly or well for 30 years. So that always makes a huge difference in your life. And I have to say, you have beautiful, clear skin, so it's working for you. That's great.
Thank you. Thank you.
Well, I know that you do have quite a bit of chronic illness, chronic conditions in your family. After you made the change, has your way of eating influenced your family members, whether it's your immediate family members or extended family members, your friends? How has it touched other people?
Yeah, it's definitely, thankfully, touched a lot of other people that are really close to me. And the first and foremost that it really touched is after I went plant-based, I have a twin sister, and my sister was diagnosed with lupus. And for some people that aren't familiar, it's an autoimmune disease that can really affect the organs. And she was really struggling to live a normal everyday life. And she was under the care of a physician, a great physician and everything like that. And I really just said, Lauren, I think that we should try a plant-based diet. If you're open to it, I'm happy to teach you how to do it and implement it. And along with the plant-based diet and other lifestyle factors, stress reduction, physical activity really came into play. for her. And she was a very healthy person to begin with, but there was definitely some tweaks that we needed to make. And thankfully to this day, I can tell you this many years later, her lupus is in remission. She's had 2 beautiful children. And she said that, I asked her not too long ago, I said, when was the last time you had a flare? And she's like, I can't even remember. I don't even know. So that is, of course, my twin sister, seeing your twin sister, your best friend like that, not be able to live life as she should in the early 20s was really impactful for me. And I'm so glad to be able to see that essentially behind her.
That is amazing. And just for people who aren't familiar, lupus can be absolutely devastating. Just really take away joy from your life. Organ transplant, it just can be very horrific to have lupus. So to say that she can't even remember the last time she had a flare, that completely changed her life. When you first proposed it to her, was she reluctant? Was she doubtful? How did she react?
Honestly, she was she was willing to try anything at that point, but being her twin sister, we always kind of joked that she was my guinea pig anyways, and that anything that I was willing to recommend and thought was important for her, she was willing to try. So we had that good and close of a relationship that she wasn't really reluctant. I think she was reluctant, like, okay, how am I going to do this? Because, scrambled eggs were one of her favorite easy go-to meals and those types of things. So I think maybe there was like, oh, how am I going to do this? But we definitely worked through it together. And it's fun to be able to have your twin sister follow the same diet. So when you have family outings and stuff like that, you're not the only one.
Yeah. Oh, that's so cool. I'm kind of always jealous about people that have twin, siblings anyway. Like, I think that's the coolest thing ever. But it's so cool that y'all can share in this and also share in the gift that it's given you so that you can both, be part of that joy and that passion for promoting a plant-based diet. I love it.
Yeah, absolutely.
Well, tell me why you chose to become a dietitian, and how has your personal diet and lifestyle woven back into your profession? So I know that you said that you learned it because of your research, at your own research outside of learning to be a dietitian. But then once you made the transition, did it feed back in?
Yeah. So my interest in nutrition actually really started as an athlete. I was a college athlete, and I was really interested in how nutrition could naturally improve my performance. And I'm a big believer that everything is multifactorial and there's more than one pillar, but I wanted to see how could nutrition specifically impact that. So that's where it started for me. But when I was playing in college, unfortunately, there were many cancer diagnoses within my family. My mom was diagnosed with breast cancer. My grandfather was diagnosed with liver cancer. My grandmother was diagnosed with breast cancer. I had a godmother diagnosed with breast cancer who's my mom's cousin. And previously, my other grandmother passed away before I was born from lung cancer. So we have so many cancer diagnoses in the family. And I really started to have this question of how could nutrition alter these paths? How could it help them during their course of treatment? And how could it help them into survivorship? And this was actually when I was playing college softball and going to school. I was actually a business major. I have a degree in business and then went back to school to be a dietitian. And it was really at that turning point that I started having more of these questions and this deeper interest in nutrition. And it was my now husband who at the time was, I really think you should be a dietitian. And I was like, of course, I was like, oh, it's way too late for that. I'm early 20s, right? Just about to graduate college. And he was really influential in me going back to school and seeking out the degree to become a dietitian. And while I was in school to be a dietitian, I told all of my professors and advisors, I want to be an oncology dietitian because that was really where my interest was. And in dietetic school, you have about a 1-hour lecture on oncology nutrition. It's very brief. It's very little. And I wanted to learn everything that I could. So I asked for, any oncology dietitian that was willing to let me shadow them or ask them questions. That was where I was finding the information. And then I got an internship with a well-known cancer center, National Cancer Center that became an intern there, and then was hired on full time afterwards. And so I kind of landed this dream oncology job, right, where exactly what I wanted to be doing. And then this is where like that plant-based story started to come into play, where I was experiencing fertility. I was researching it more on the side and started to implement it with my patients, and then implemented it for myself. And one of the things, seeing how impactful it was for my patients and helping them to reduce their side effects, improve their quality of life during such a really difficult time in their life, was something that was really exciting for me. And so how it impacts my everyday diet and lifestyle, and I always tell my clients, is that it's actually really helpful for me because it's that constant reminder, right? We're all human. I would never tell anybody that I have a perfect diet because I don't, right? But that constant reminder of working with other people and supporting each other in the whole process is really powerfully impacted in my life and how I continue forward as well.
I love that. That's so beautiful. Well, let's talk about a tough subject. And before we even started recording, we were thinking about the last time we actually saw each other in person, which was, It was May, right? May of 2022.
Correct.
Right? Yeah, last year.
Mm-hmm. Yep.
So it's not even been a whole year yet.
Yeah.
And and you had just discovered something that has changed your life. So tell me about your cancer diagnosis and how it has impacted you.
Yeah. Ooh, that is quite a loaded question, but I've had a lot of learnings in the last, it's been about 9 months since that diagnosis. So really, I believe that my job as an oncology dietitian has actually partly saved my life and had early detection, because I knew that I wasn't too young to have breast cancer. That was my diagnosis. I had worked with many young breast cancer survivors before. And what happened is I was only 10 days out of breastfeeding my second child, and we found a lump at my annual exam, and we didn't think too much of it because I was only 10 days finished breastfeeding and how much the breast changed with breastfeeding. And so we didn't really do much about it. And I say me and my physician. And I went home, and I think because of the role that I am in, I kept feeling that lump. I made sure I knew what she was feeling, the physician, came home and monitored it. I had had a previous lump between my pregnancies that had gone away between a cycle or after a cycle. So I kind of knew I was looking for, okay, any changes? Does it go away? And it didn't go away. And the only way that I can describe it is every time that I felt that lump, I felt really anxious. And I was actually preparing for this conference that I met you at, and I was speaking on breast cancer nutrition. And while I was preparing some of my slides and looking through some of the research, it was talking about breast cancer after pregnancy and breastfeeding. And although it's rare, it popped up, and it really, to me, felt like a sign I need to really investigate this a little bit more. So I messaged my physician, and my mom is a breast cancer survivor and was also the same physician for my mom. So she knows the family history quite well. And so that prompted, okay, let's get an ultrasound right away. And I really wanted peace of mind before I came to this, this conference where I was speaking on breast cancer nutrition. And that ultrasound, while I was in the ultrasound, I knew that something wasn't right just based on reading the faces of the technicians. And all of a sudden, ultrasound led to mammogram, led to biopsy, all within a few hours of each other. And the radiologist did say that day, she's like, I believe I know what I'm looking at, and if I am, it's breast cancer, but we need to wait to confirm with the biopsy. So 2 days later, they called and did confirm that I did have breast cancer. And it was a whirlwind of emotions, as you could imagine. A lot of fear, probably anger, frustration, and then so much in the beginning of the whole process, there's so much unknown. And that is really scary. And I've said oftentimes that I believe my job as an oncology dietitian and working in cancer as a medical professional has been a blessing and kind of a curse in the whole thing, right? Mostly a blessing, because I really think that's what brought me in. And to ask more questions, to advocate like something doesn't feel right, we need to take a closer look. The curse is that I've seen so many different scenarios play out from there. And that's where that unknown leads to so much fear. So then I went to the conference where you and I met the day after, and my whole family was telling me, like, you don't have to go and do this. You do not have to leave. Because I was leaving my family for a weekend, and I was just diagnosed with breast cancer. And I thought, I need to do this. I need to do this for me. There's nothing that I can do different between my Friday night flight and my Sunday evening flight back home. And so I went, and I'm so glad that I did, because that conference was incredible, and it really helped put certain things into perspective for me. And then when I came home, that's when the whole gamut of appointments started. The meeting with the surgeon, and right away they recommended a double mastectomy, where I was like kind of taken aback, because I didn't I had it in my mind that maybe I was going to go in for a lumpectomy and that was going to kind of be it. And because that was sort of my mom's story. And she was like, no, we definitely need to have a mastectomy. The lump is too close to the nipple. And so actually she did recommend a single mastectomy at first. And at the time, the diagnosis was DCIS, meaning that the breast cancer was still contained to the milk duct. And so that's a really early stage, very good. But she was very concerned that it was not just DCIS the way that it was presenting. And so I had another biopsy done, which went on to confirm DCIS. And so the next step was decision on surgery, and what surgery did I want to opt for. In that meantime, I had genetic testing. Because of my age, I was 33 when I was diagnosed. My age automatically qualified for genetic testing, which we had never done before, even despite the family history on both sides of my family of breast cancer. And it did confirm that I actually do have a genetic mutation, and my mother is the carrier of it. And to me, I was actually really kind of surprised, even though I knew that there was such a generational impact of cancer, because only 5 to 10% of cancer cases are related to a genetic component. And it's multifactorial. Just because somebody has a genetic mutation doesn't mean that they're going to get cancer. To me, it was surprising. It was maybe helpful to hear that there was maybe this other driving factor as well. And so that changed from the recommendation from a single mastectomy to a double mastectomy because of the genetic mutation and the risk of recurrence in the other breast. And so I opted for a double mastectomy, and I had something called a D-flap reconstruction, which actually uses your own tissues to reconstruct the breast instead of using implant procedure. And it's a very intense, it's a 10-hour long procedure with a very long recovery. But I felt like that was the best choice for me mentally and emotionally moving forward. And I'm really glad that I had that surgery. I'm 9 months out of it now, and I healed really, really well from it. But during that surgery, we did a surgical pathology, and what was originally a DCIS diagnosis turned into actually an invasive component, which means that the breast cancer had left the mammary gland, the milk duct. And from that standpoint, more testing needs to happen and go forward. And what was ended up being confirmed from there is that I had what's called triple positive breast cancer. And that for those who may not be super familiar with it, there's 3 different components that they look at in breast cancer and what might drive or fuel that breast cancer. And that's estrogen, progesterone, or a protein called HER2. So by being triple positive, it means that the breast cancer had all of those receptors on the cancer. The very positive thing about that is there are lots of treatment options for a triple positive breast cancer. What that also meant for me is that chemotherapy was recommended. So after about 6 weeks after surgery, I started chemotherapy and immunotherapy. I had a weekly chemotherapy for 12 weeks. And then after the 12 weeks ended, around Thanksgiving time, I started every 3-week immunotherapy, which happens for a full year. So I'm actually currently still in the middle of immunotherapy. I have infusions every 3 weeks. But I am so thankful to be able to say that I tolerated chemotherapy really quite well. I think that's where the blessing of my work really came in. Not to say that there weren't hardships, but I had so many tools and resources to be able to help me through it. I knew how to manage nausea. I knew how to manage bowel issues, those types of things. And I could teach my husband how to help me and support me in those processes. And I think that was really impactful and part of some of my success to go through chemotherapy. And I'm so very thankful for that. And you can see as well, but I saved my hair. I used a process called cold capping. And cold capping has been around for quite a while, more in like Europe and other countries, and it's more making its way here to the US. But essentially you are using a really, really cold ice pack on the top of your head during the infusion. And it essentially, the idea and the concept behind it is that it restricts the blood vessels at the very tip of the hair follicle, not allowing chemotherapy to be delivered to the end and the tips of the hair follicle, allowing you to be able to keep your hair. I had very great success with cold capping. As you can see, I'm 4 months out of chemo at the time this recording, and I lost probably 10 to 15% of my hair, which is a very, very good outcome with the cold capping system that I used. Most people going into the treatment that I had, 50% of patients saved at least 50% of their hair or more. So I was definitely a very, very positive outlook from the cold capping, and I'm very thankful for that. It was very challenging because it was very uncomfortable. I was also icing my fingers and toes during treatment because the type of treatment I was on also can increase the risk for peripheral neuropathy, or the tingling and numbing in your fingers and toes. So I was free. It was so cold, right? Because I'm icing my fingers, my toes, and my head for about 2.5 hours. It was very uncomfortable, but during the time, I just tried to remind myself like the reason why I was doing it. And now when I go to immunotherapy and still have like the infusions, I'm so grateful that I'm not cold capping anymore, because it was a lot of work, but I can really say 4 months later that it was worth it, because I got my first haircut since June the other day, and it was rather exciting to be able to have a haircut this close to chemotherapy.
Wow, that's amazing. Yes, your hair looks beautiful. So that was going to be one of my questions, if you did something. I have seen a video, like somebody posted a reel of them doing their last cold capping for their last infusion. It looked so intense, but I'm just amazed at how proactive you are, that you're just, you've taken this diagnosis. It's devastating. It's so emotionally heavy. There's probably so many emotions, but you're like, okay, I'm just going to do these things. I'm going to, try these different things to improve my outcomes, to match my goals and my well-being. And so I definitely want to talk more about that, including some other things that you have done to help manage the side effects of chemo. But before we get to that, I do want to talk a little bit more about an emotional piece, and something that I have spoken to a guest before on the podcast, which is how particularly difficult it can be to get a chronic condition diagnosis, especially when you're in the position that you're in. Like, you're a plant-based professional and you work with other people that have been diagnosed with chronic conditions. So tell me about your thoughts and your mindset around that. How has it affected you? How has it influenced you? Did it cause you ever to have doubts?
Yeah, this is a great question. And this has been a big, huge piece of my emotional part of the journey. And I always said, with my family history and the work that I do, I always told myself, if I were ever to sit in that chair and have that diagnosis, I want to be able to look back and say, I did what I could, right? And so at the moment of my diagnosis, I thought about that. I thought about what I told myself. And I thought, can I say I did what I could? And I believe that I did. I did what I could. And now, that is not to say I was perfect, because I wasn't, right? I was 10 days out of breastfeeding an infant, right? Sleepless nights, like I'm running a business, I have an older child, right? There was not perfection in my diet or lifestyle. There were definitely things that could have been improved. But in the grand scheme of things, did I do what I could? Yes, I did what I could. And I fully believe that my diet and lifestyle actually really made this incredible difference for me. Maybe it allowed us to have this incredibly early detection, right? And then it was this realization, because there were so many people that told me, what? You have breast cancer? You are one of the healthiest people I know, right? And sometimes that was really hard to hear because you know how unhealthy there are lifestyles out there. And you, of course, you ask the question, why me and why not that person, right? I always wondered why my grandmother passed away at the age of 52. She was a smoker. She passed away from lung cancer. But why did my grandmother pass away from lung cancer at 52, where this person is 80 and still smoking, right? And so there's a lot of questions of unfairness and why me. But I also, and I think it's okay to ask those questions, but at the same time, not sit in them for too long. Because to me, it was this realization of like, I can't change this. This is what happened. What am I going to do next? And that is really where the things that you mentioned in terms of that, I really am doing everything I can to take back my power, to take back my control, right? There are so many things in life, but also in cancer and chronic disease that are out of your control, right? But what can I do to help put some of that control back in? Give it to me. That's where the cold capping came in, right? That I knew going in, I could still very well lose all of my hair. And we had conversations with our daughters beforehand, like, mommy may lose all of her hair. She may not. Like, she may look different, right? So we took those things into consideration, but it was the nutrition piece of it, the cold capping, the fasting that I think we'll talk about. These were all ways to help empower myself and take back some of the control when everything else feels so out of control. So that's really kind of where the mindset piece has been. I have had imposter syndrome of, here I'm promoting a plant-based diet and I'm still a plant-based person with a healthy lifestyle and I still get cancer. But even beforehand, I knew that you could do everything right and you can still get cancer or a chronic disease. But again, I come back to I did what I could. And that gives me empowerment to move forward and that I still have some control and I'm going to do everything I can in my control to live a healthy life, prevent its recurrence, and just move forward from there. And so it was really this realization of, gosh, I did everything right. How did I get cancer? To the things that I did right are going to be the things that help me get through this. And I think they very much did.
That is so powerful. And there's just so many positives that I see in your story and your approach to all of this and how you think about it. But that's why I go back so much. And I'm very careful. I'm not going to say I'm perfect, but I'm very careful when I talk about conditions and illnesses, that it all comes down to risk. And there's so many things that we can do to decrease our risk, but there's never zero risk because being alive is essentially a risky thing,
Yep.
So
100%.
Like you just can't eliminate all risk. And
Yep.
So I think, but it's also hard too, because you don't have like another version of you living in this setting and this setting to see the difference. It could have been completely different. It could have been even a more difficult thing. And so I think you're right. Because we can and because we're willing to, we should do the best we can. And then we just cross each bridge when we get there, adapt, tweak things in order to match our goals for our well-being and our longevity. And we just do the best we can because we're human, and being human is essentially being exposed to risk day in and day out.
Exactly. And that's what I've always said too, is that it's really just risk reduction. There's no guarantee in anything. Like as much as we would love to have guarantee, that's just not going to happen, and it never will. So, and some of that risk reduction and the things that I did was really to like, my kids were super helpful. I've said in this whole process that parenting has been kind of one of the most difficult things through cancer, right? Parenting itself is hard, and then throw a cancer diagnosis on it and it becomes like even harder. But at the same time, like my kids have been the thing that keeps me going, right? I'm going to be willing to do these things for the betterment of my life because it's the betterment of their life. And I think that's where some of the motivation comes from too.
Yeah. And then for them to witness you doing one of the hardest things you've ever had to do in your life and get through it, and seeing the ups and downs and seeing how you're able to approach these different changes in your emotions. I mean, what great learning for them too, to know that life isn't perfect and things are going to happen. And this is how we flow like water through these issues. And you said earlier that, you get imposter syndrome. I think that happens to all of us for sure. But I'm also wondering what you think about your cancer diagnosis and the empathy it gives you for your clients. Because obviously you had empathy because you had it in your family. But now you have felt what it is to have a cancer diagnosis, to go through all that uncertainty, all that anxiety, to actually have the physical symptoms. There's no replacement. So I'm just wondering if you've heard from your clients how they felt even more comfortable with you because they know for sure that you understand.
Yes, 100%. And I think there's so many different silver linings in this cancer diagnosis. I've said I've learned so much in this entire process, and I'm still learning. There's so much more to learn. I feel like I've learned a lot of things at a really young age that either some people don't learn until much later or maybe never learn in their life. And those blessings are the silver lining. I've said, man, I really wish that there was a way I could have learned those things without a cancer diagnosis, without a life-threatening condition. However, when it comes to the work that I do, it really does and has taken my work to a different level of being able to empathize with my clients. And, some of my current clients that are going through chemo, they've just said, it's really nice to talk to somebody who understands and has been there too. And I always say that my journey is not the exact same of somebody else's. All of our cancer journeys are very different. But those feelings, I do think there are some things that if someone's not a cancer survivor, they just can't understand, right? And I've said that about my husband. He's like, I can't understand what you're going through. And vice versa. I can't understand what he's going through. I can't understand what it's like to watch your spouse and best friend go through this, right? And I've told him before, I would rather be the one in the chair than him because I would probably be even more of a mess on the other end. So that empathy is something that is so critically important. And I think I've learned a lot about the difference between sympathy and empathy during this entire process, and how you don't need to fix something for someone, you just need to be there for them. Just sit there with them. There's a really great cartoon image of a Brene Brown explanation of sympathy and empathy that I encourage anybody to just Google, Brene Brown sympathy and empathy, and it's really great. And so I've learned a lot of that, and it has really transformed my work in a way that I never thought it would, and it probably never could have unless I'd gone through this. So I'm excited for what it brings to my work so that I can just help people in a deeper way than I ever imagined.
Yeah. I mean, I can just feel it. I can just feel your heart so open, and it sucks. It sucks to have to go through something so difficult in order to get some of these rewards from it. But I think if we were to have it any other way, it just wouldn't land the same way. It's kind of like when you read a textbook and you're like, okay, I'm going to memorize this stuff, but then you actually experience it and see it in your practice, and then you learn it. You actually feel it in your bones. You can feel it. And that's how life is unfortunately we got to go through all those tough things.
Yep.
Well, let's talk a little bit about fasting because it's something I'm particularly interested in. And I had seen you mention in one of your posts or something, and I was like, oh, I'm wondering if she tried fasting during her chemotherapy infusions because I know there's been some research on it. So tell me, how did you learn about it? How did you incorporate it into your cancer treatment protocol? And what has your experience been with it? And then also I'm interested to know if you've just incorporated into your lifestyle in general, like any intermittent fasting or time-restricted eating.
Yeah, absolutely. This is a great question. And I get a lot of questions about fasting and so forth. And of course, I always like to say that the fasting protocol for chemotherapy is going to range by the individual and is really necessary to be under medical supervision, either with an oncologist and or oncology dietitian. And I think that's super important to say because even as an oncology dietitian, so I'm treated at a cancer center that I previously worked as the oncology dietitian. So I know my oncologist was my past colleague, right? So he knows the work that I do and so forth, but it was still important for me to run by him what I was doing. So I always tell people it's very important to have a conversation with your oncologist, with your medical team about what you're doing, because it may not be appropriate for all individuals, because there are risks of fasting and it can be done in a detrimental and harmful way. And we want it to be done in a way that can actually support rather than harm. So I always want people to know that it's not appropriate for everybody. I'm thankful for the research that I had coming into it and knowing it, and also knowing that I was a good candidate for it, and because of my experience and expertise. So with that being said, I had worked with patients prior to my own diagnosis and working them through fasting with chemotherapy, particularly if it was of interest of them. And there is a fair amount of research, and there's more growing and growing research. But essentially what the concept of fasting for chemotherapy is that there's a level or a degree of fasting prior to receiving the start of chemotherapy and following chemotherapy. And in the research, there's several different protocols. There's been lots of different protocols tested between the various number of hours of fasting prior to that chemotherapy start and for the number of hours afterwards. So generally what we're seeing in the research and the different protocols is anywhere from 24 to 72 hours prior to receiving chemotherapy, and for 24 hours after receiving chemotherapy, there may be this fast. And what that fast looks like can vary in the different protocols as well. Some have, let's say, less than 250 calories a day, where they're consuming maybe vegetable broth, maybe some juices if they're keeping it under a low caloric load. So really I turned to the research about, okay, what am I going to do? And what was really interesting about my fasting and my chemotherapy is I received chemotherapy weekly. So as you can imagine, if I were to have fasted for 72 hours each week, it would have been absolutely unsustainable. Right? And so that's where that's really important to consider, is like, okay, the research says this, but there wasn't much research on fasting weekly with my particular treatment. So I really wanted to I went into it saying, okay, this is what I'm going to do. I'm going to adjust as needed if necessary, and I'm just going to see how it goes. Right? So I ended up fasting for a period prior to chemotherapy, and I started by including some juices, and then ended up getting rid of that at some time. And then I would look at the clock, literally, so it was mostly just water all throughout the day. And then I would look at the clock as soon as that IV pole and the IV pump beeped of when the chemo was done. I looked at the clock and knew that in 24 hours, that's when I was going to be having my next meal. And it was hard. It was really hard. And the first part of it was the first couple cycles were easier, and then it got harder as the cycles went on because it was every single week. But there was a point in there, and only a couple cycles in, that I had lost too much weight too quickly. And too rapid of weight loss during chemotherapy is not a good thing. We're losing lean body mass. It can increase the risk for malnutrition. So it was, thankfully, I had this, the sense to be able to say, Allison, this is too quickly. This is not sustainable for another 8 cycles. So I adjusted to have a shorter fast. And the concept between fasting and chemotherapy is that when you have this fasting period, to simplify it, is really that essentially the healthy cells within our body go into protection mode. Okay. It's not getting fuel. It's not getting food. So it goes into these protections mode. Cancer cells don't have this mode. They only have the mode of grow, divide, grow, spread. We don't care what you do, just keep growing. Okay. So the idea and the concept of it is, if we're in this fasting mode, then chemotherapy is delivered during this fasting mode. The cancer cells will uptake the chemotherapy more effectively, more efficiently, increasing the effectiveness of chemotherapy against cancer cells, while protecting the healthy cells. So in the research, we're seeing improved reduction in side effects with fasting for chemotherapy. and the improved efficacy of the chemotherapy during this fasting period. So that's what I did. And I was always looked forward to breaking the fast the next day. And I usually broke it with a tofu scramble with a bunch of veggies in it. And that was like probably my go-to way to break my fast. And when it got really tough, I actually turned back to the research and like reread the research to like remind myself why I was doing it and why it was important, because I was still feeding a family while I have 2 little kids. I still need to prepare meals and so forth. So it was hard. I couldn't just exclude myself from society for a couple days to make it a little bit easier. But I do believe that that is something that really played a role in reducing my side effects from chemotherapy. I had very little nausea. I was able, and the thing about weekly chemo is like you don't necessarily get as big of a dose because you're having it weekly, but you just don't have a lot of time to recover. So I found that it was really impactful for me, and I did it for every cycle. So I don't know what it was like without it. I was curious to test it a little bit to be like what it would be like if I didn't fast, because I wanted to kind of be my own guinea pig. But at the same time, I didn't want to risk it because I felt relatively well afterwards. And like, I don't want to risk that. It's not worth it. So that's how fasting landed for me during chemotherapy. And I also now, as I think about it into like this part of my life, I do use a form of, I guess you could say time restricted eating or fasting, but it's really from night to morning, right? And we see in the research, especially in breast cancer research, that women that are breast cancer survivors that incorporate at least a 13-hour fasting window between the last time they eat at night to the first time they eat in the morning, we're seeing that particular study found a 36% risk reduction in recurrence rates. So to me, I personally really strive for like 12 up to a 14-hour fasting window in the mid, from last time of the day, but I also don't sweat it, right? Like if I wake up in the morning and I'm extremely hungry or irritable or could tell that I need to eat, then I eat. I don't just be like, oh my gosh, I have to wait 2 more hours. I don't do that approach. Really what it has done for me is that it has really just changed how our evenings look. We used to eat a little bit later in the evening because my husband doesn't get home from work until about 6:45 at night. And we were waiting because I really value the importance of family meals and sitting down at the table all together. But it was just getting far too late, especially for 2 little kids. So now me and my girls eat at 5:30, right? We were able to move that window up, and usually because sometimes little kids just take a long time to eat, which is totally acceptable. Once dad walks in the door, they might still be eating and then we can still have that family meal. But because of his work schedule, then we just have it more at lunchtime if he's home and so forth. So we just change the way we approach things to incorporate our family meal at different times and eat a little bit earlier, which is good for me and it's good for the girls too.
Yeah. Oh, that's so great. And I love how you were able to be flexible and tweak things for you and the way that it worked. Because you're right. If you're having to fast like 3 or 4 days every week, that's too much fasting, not enough feeding, not good for you. So essentially you were fasting for 24 hours after your chemo finished, but were you shooting for about 24 hours before your infusion too? So fasting for about 48 hours a week?
Yeah, it ended up being longer than that only because I would look at what time is chemo supposed to start tomorrow and then just based on how chemo starts. And so I'd say I'd averaged about 56 hours each week.
Okay.
There was a couple in the
beginning
time.
That's a long fasting window.
Yeah, in the beginning, the first few cycles, it got closer to 65, and that's where it was too unsustainable. And that's what I really looked at, like my weight and everything like that. And when I did make that adjustment, it was much more sustainable, and my weight stabilized. So that was a really good thing.
Yeah. Well, that's really awesome about not having much nausea. So I always think if I ever have to get chemo, that's like the thing I dread the most because I cannot stand being nauseated. So I've already decided if that ever happens to me, I'm definitely going to try the fasting because to me it would be worth it just to not have nausea.
And I never had to take any of the nausea medications that they send home with. So I don't know if that was the benefit. And also we do see for example, that women, if they have if they had children and they were nauseated during pregnancy, they were more likely to be nauseated during chemotherapy. There's a similar mechanism there, they believe. So I did have some nausea during pregnancy, but it wasn't super intense. So it's just interesting to see it kind of play out from that standpoint too.
Yeah, super interesting. All the genetic differences in body types and how we react to things. Yeah. I'm curious if there's anything else that you've changed or tweaked in your diet and lifestyle since your diagnosis and treatment.
Yeah. I get this question a lot, like, what are you doing differently, like, now that you had it? And I would say that I'm not doing a lot differently other than the fact that I'm being more intentional about some of the things that I used to do. I'm being more intentional about doing them more regularly. So for example, I'm a very good cruciferous vegetable eater, but every day there's broccoli sprouts. I'm also on a medication that can cause like hot flashes and all these types of things. And based on the research with hot flashes and diet and so forth, I'm very intentional about every day making sure I have a tablespoon of flaxseed. I have a serving of soy every day. So some of these things I'm very intentional about to continue to help with some of these side effects that are related to some of the medications that I'm on that help reduce recurrence. So I'd say those are things that I always did beforehand, but I'm much more intentional about doing them much more consistently now. And I think cancer was kind of a little bit of that wake-up call to remind me of some of the things that are important to consistently do. And then the other thing is exercise. And even if it's just walking, it's so easy, I think, as parents to be able to just push to the side the exercise because you're running around taking care of the kids. And I'm much more intentional about I don't miss a day of my walk. And I do other exercises, but the walk is the minimum, right? If I get at least a 30-minute walk every day. And I'm fortunate enough that my husband is like, go, I got them. I got the kids, you go. But if that's the case, then I take them with me. And so we're much more intentional and consistent with those other lifestyle factors too.
Walking is so good too because it has such a positive impact on mental health. It just kind of helps clear your mind. And especially if you walk outside, you get that connection to nature too. And sometimes you see your neighbors walking, you say hi to them, feel connected to them. So I love how walking kind of like ticks a lot of boxes when it comes to well-being.
Yeah, we actually live walking distance from the school that our daughter goes to, and we walk most mornings. I live in Wisconsin, so in the dead of winter, we don't walk quite that much. But even my daughter was saying today how much she enjoys walking to school with mom because it's when we get to chat and talk, and she sometimes rides her bike, sometimes rides her scooter, and like we're getting out in nature, and I think it creates really healthy habits for them too. And she was even talking this morning about how walking to school saves gas in the environment, right? Because I'm not driving the car, right? So like it's so fun to watch their little minds connect all these different pieces for it as well.
Oh, I love that. All right, Allison, what do you wish more people knew?
Ooh, I wish more people knew that nutrition can be an incredible complement to traditional cancer therapies and really help improve side effects and quality of life just during treatment and after treatment, because that's not something that we see traditionally in the medical community right now and the cancer community. And so I wish that there was more emphasis on nutrition for patients that are going through treatment.
I love that. It's your thing. That's what you do. So that's great.
Yep.
Do you have a morning routine, or are your kids still too small to make it so you don't really have your own routine?
Oh, yes. This is a great question. My morning routine changes so frequently because of that. And like, I have a 2-year-old and we just kind of changed her nap windows and wake windows. So I don't have a very specific one right now, although I would say in the last like several months or weeks, one of the first things that I do, wake up and I do some prayer and focus, some meditation, but it's really short because as parents, many people know you just don't have a lot of time. So I try to sneak that in before the kids wake up because otherwise it's not going to happen. But then it's really, I get my daughter ready for school and we love to walk to school. And that's right now our current morning routine. And I think I'd love to have this really extravagant morning routine, but I think it's also important to take into account what's realistic, right? I have 2 little kids. and so forth. And it's going to change constantly. So if I can just have that 15 minutes to myself, and I like to think about that is then I'm on offense rather than defense, right? If you're waking up, with the monitor waking you up instead of you waking up before then, playing defense, I think, is a lot harder, and I prefer to play offense. So that's my goal in terms of morning routine, is to wake up on the offense, have 10 to 15 minutes of time by myself, and then kind of jump into the day.
I love that. Yeah, any is better than none. And you're right. It's almost like you get that a little bit of head start to set your intention, instead of just waking up and it just feels like pure chaos and like this race and rush to get everything done and everybody's frazzled. I just remember, and it does change. And that's why I mentioned, if your kids are still too young, that you don't have that time, because when your kids are young, you don't have that much time to yourself, but it changes. And as I interview people that have grown kids or kids that have left the house, then there's time for the luxurious, like 2 to 3 hour morning routine. It does change over time.
Absolutely.
I love it. Allison, you're just so beautiful. Thank you so much for taking this time, for being so generous and open and vulnerable with your story. I think that this is going to help so many people, not only to hear your story and your journey, but to feel the positivity and the love and the compassion that you have. So thank you. So can you please tell us where listeners can connect with you, and tell us about what services you offer? Because it looks like you have some really comprehensive ways that you can work with people.
Yeah, thank you so much. That means a lot for you to say those kind words. I really appreciate it. And I always say that, if sharing my story can help just one person, that it's totally worth it. And the number of people that have told me that they got their mammogram, or they had a colonoscopy, or they went and got checked because they heard my story, like that means the world, right? Because early detection is so important. And so with that being said, I'd love to connect with listeners. Best place to find me is actually my website. It's wholesomellc.com. And also the social media platform that I'm most active on is Instagram. And then that's at wholesomellc.com as well. And when it comes to services, I have an online program that's really comprehensive in terms of plant-based nutrition. And I really teach people, anybody that's interested in plant-based, plant forward. I always say people that come to work with me, some people are interested in being 100% plant-based, and I'm super supportive of that. And I have people that come to me that don't want to be completely plant-based, and I'm supportive of that as well. I do tell people that, my motto is eat more plants, as simple as that. So you don't have to be wanting to be a full vegan or vegetarian to work with me, but we're going to promote whole plant-based foods as much as possible. So those are the type of people that I work with. Often, I do have a large cancer population, but I do work with individuals that are just interested in plant-based nutrition overall to improve their overall wellness. And within that, I have an online course that comes with a group coaching component, which I think is so important to have that community that is kind of walking a similar path. I had someone ask me the other day who was from out of town. I live in a suburb of Milwaukee, Wisconsin. She's like, are there a lot of really plant-forward options here? I was like, no, no, there's not. It's growing, but it's getting better. So if you can have a community around you no matter where you live, but other people that are kind of experiencing a similar walk, it can be just so helpful from that standpoint. So that's where the group coaching component, and I do individual coaching as well. That's a perfect program for people that are going through cancer treatment, that are really looking for somebody to be able to help walk alongside them, make those adjustments as needed, and have that really one-on-one attention. So that's great for the cancer treatment patients or people that are looking into survivorship that just do want more of that individual hand-holding, I guess you could say, in terms of helping to improve their diet and lifestyle. So yeah, those are the programs, and you can reach me at wholesomellc.com or on Instagram at wholesomellc as well.
I love it. That's so great. I'm so glad that you do that, and definitely we'll put that into the show notes. So anybody listening, you'll have direct access to Allison. You can look at all the things that she offers and work with her if it feels like that's appropriate for you. Okay, last question. Leave us with your number one tip for people that are affected by cancer or chronic disease and are ready to make a diet and lifestyle change. Where can they start?
Absolutely. My favorite recommendation is to add before you subtract. And what I mean by that is I think sometimes it becomes very overwhelming to think about the things that maybe we shouldn't have in our diet or that are recommended to eliminate from our diet, right? It becomes very overwhelming and can lead to maybe no change at all. But instead, if we can focus on adding more whole fruits, vegetables, whole grains into the diet and not worry so much about subtracting right away, people usually find that those additions start crowding out the things that want to be subtracted anyway. So if you could really set your mindset on adding before you subtract, I think you can be incredibly successful in the short term and in the long term.
I love it. Yes, I 100% agree with that. And it completely changes your perspective on a food. If you're thinking about, oh, it's going to be such a drag to eliminate this, eliminate that, and then you look at the rest of your food and you're just like, you're not even excited. But then instead you change it to, how can I eat more of this and make it delicious? And now I'm excited to try these things. It changes your whole mindset and the way that you approach it. So I love that advice. Alison Tierney, thank you so much for taking the time to be on the show today, for sharing your story, for all the work that you do in the world. So grateful for you, and I hope that you have a very plantastic day.
Thank you so much for having me. It was an honor.
Hey, veggie lover, I hope that you loved today's episode. Will you take a second and do me a huge favor? Please subscribe to my podcast so that you never miss an episode. You're the reason I'm here, and I want to share it all with you. Thank you for listening, and have a plantastic day.